Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. Whether you've accidentally run your hands under scalding hot water or actually come into contact with the flame on the kitchen burner, burns are definitely no fun. A burn damages your body's tissue and can be extremely painful. Here to tell us more about ways to prevent and treat your skin from burns is Express Care's Dr. Jitka Lom. Thanks, Doc, for coming in as always. Now, what are the different types of burns and how can someone tell the difference?
Okay, so you probably heard of first, second, and third degree burns, and that refers to the thickness of the burn. So if you look at the skin, and if you took a cross section, you have the superficial top layers, a deeper layer, and then the deepest layers including into the muscle and so on. So the first degree or superficial burn is just on the surface. It's pink or red. It hurts. When you press on it, the skin turns white, but it hurts. The second degree burn, or superficial partial thickness burn, is actually starting to blister. You're getting a red blister on there. It may not feel so much pain as just with deep pressure you'll feel more pain. And then there's the third degree burns, which are basically either very white or gray color or sometimes completely black and charred, and the skin is completely destroyed. That will never heal, and there's no pain. So it's a completely destroyed skin, and that has to actually be removed for healing to occur.
Okay. Now, burns can be caused not just by heat, when we think of, we burned ourselves on the iron or on the stove or something, but also by chemicals, electricity, sunlight, or radiation. Can you explain a little bit about that and how your skin reacts to these different elements?
Yeah. So with the chemical burns, you have acid and alkali. Those are usually in industry. People will get burns accidentally splashing something on themselves. And that will cause sometimes extremely severe burns in large areas from a splash. As far as the electrical burns, sometimes with those ones what you see is not much on the outside, but there's a lot of damage on the inside as the electricity has spread. So for example, with lightning or with an electrical cord or something, there might be just a small entry wound, but a lot of damage inside to muscle, deeper injury. And then as far as sunburns, most of us have experienced those with redness and then peeling and blistering and so on. And that's from the UV rays, from the UVA rays that come from the sun. So I guess there are all kinds of ways to get burned, and your poor skin is trying to cope with it as best it can.
Okay. Now when we talk about burns, you were talking earlier about swelling and blistering and scarring. How does someone go about treating them? And you were mentioning that there's different ways to treat it based on the varied
severity.
Degrees.
Yeah. So for your superficial burn, I guess the most important thing is to cool down the skin as quickly as possible from whatever kind of burn you have. And a lot of people will put ice. It's not necessary always to put ice. It's very, very painful when you have a burn, and ice can actually cool it down too much. So just cool water, even running it under cold water, trying to get cooling to occur so that you stop the injury from occurring. That's first aid. After that, your goals in burn therapy are to prevent infection and prevent deformity, because if the skin is very, more severely, the deeper burns, they will start getting what are called contractures, when the skin kind of pulls together tightly to try to heal, and then it can be a very ugly scar and even cause inability to function. So those are the goals, and infection being the most imminent one when people get a burn. So antibiotics are used. And
so when we talk about that, what kind of over-the-counter medicines do you recommend?
Yeah, so over-the-counter, let's say you have a mild, if you have a blistering burn that covers more than, let's say, 2 or 3 surfaces of your palm. We use something called a rule of 9s, but if you use 3 palms as an area bigger than that, you really got to go get checked in the hospital. Okay, you shouldn't be dealing with that at home or in a clinic, something. If you have a smaller burn at home, you would basically cool it down and apply antibiotic ointment, which you can buy over the counter. Don't use Neosporin, use either polysporin or bacitracin. You can buy these over the counter. These are names you can recognize just on the tubes over the counter. And you can put that on a couple times a day and control your pain with either Motrin or Tylenol, and keep it very clean. put a dressing on it so that it doesn't get infected.
Okay, one last question before we throw to break is, what are ways to prevent getting burns?
Yes.
There's a lot of ways. I mean, from sunburns, you put sunscreen, making sure that your kids aren't near open flames, things like that.
Yeah, I think awareness is the most important thing. So what you're handling, if it's electricity, chemicals, a fire, understanding that there's risk there. So you want to, especially with young children, keep them away from hot things and teach them, that safety. So one of the worst things that can happen is when people are, boiling things on the stove and it tips over, the pot breaks or the pan breaks, and then there's a burn. And of course, getting a smoke alarm in your home to make sure that if there were a fire, that you would be safe to get out.
And this is perfect timing to have this discussion since it's Fire Prevention
Yes.
Month. So it is time to break away, but we will pick up our discussion on burns when Healthy Living continues. Stay with us.